welcome to episode 2 of Ready, Steady, Rehab on Wisp Sports Radio.
When I told you I was going to give you advice.
Ready, Steady, Rehab is an all-new podcast about sports injuries, what can cause them, the symptoms to look out for, and rehabilitation process.
Well, you can't see me through those innocent eyes. You're too far away to let me down.
Welcome back to the show. I'm Dr. Heather North, Doctor of Physical Therapy. On today's episode, we're going to be talking about the dreaded what to do about low back pain, something that a lot of people have really experienced, and what you can expect. Before we get into this topic, I just like to remind you, I have a little small practice in Louisville, Colorado called Red Hammer Rehab. And again, we specialize in sports medicine injuries. All right, so let's get into the nitty-gritty about low back pain. In our last episode, we talked a little bit about why see a physical therapist first. With low back pain, this is especially important to see a physical therapist first. I really like to practice research-based, evidence-based. That's how at the University of Colorado we were really trained in our musculoskeletal education. So it's extremely important to see a physical therapist within 14 days. That's 2 weeks, because they can give you a substantially better prognosis and a substantially better outcome if you can see that physical therapist within 14 days. I mean, obviously, we see a lot of patients who come in, months after seeing their primary care. Things are really getting stirred up in the medical field. The old ideas of, oh my goodness, I strained my back, I should sit on the couch for 2 weeks, you should have bed rest, you shouldn't do anything, are really completely getting kicked out completely. We're really understanding right now that it's important to stay active with low back pain and not be fearful of it. Really, the worst thing that you can do right now, if you have low back pain, is to do nothing and to sit there and not be active. So if you do see a physical therapist, and again, I really, really encourage you to see a physical therapist if you are having back pain. There's tons of research-based treatment options. And we operate so much from the mindset of treating the patient's symptoms that they're describing to us, as opposed to going by imaging. And the reason that is the case is because imaging doesn't always go hand in hand with what the patient is experiencing with their symptoms. And now a lot of very experienced neurosurgeons aren't even recommending MRIs for low back pain patients because, first of all, it scares the patient because most patients, especially adults between the ages of 20 and 80, are going to have some type of a red herring or piece that comes up on an MRI that scares the patient and makes them begin to think that their back isn't healthy. And the second piece of this too is that even if there is something that comes up on the MRI results, it doesn't necessarily go hand in hand with what the patient is experiencing. So we could actually be treating the completely wrong issues. Back in the 90s, when MRIs were taken almost of every patient, there was a lot more back surgery that went on. Patients had really horrible outcomes after surgery. And the reason being is because the surgeon would take the MRI and they would operate on that L5 disc herniation or the pinching or the arthritis that they thought that they saw, but they weren't really listening to the patient's symptoms. So the patient might not have really been experiencing symptoms from a disc herniation, but they went ahead and had surgery for a disc herniation. So now you're recovering from a surgery you didn't need, and your initial problem was really never treated. So what can you do? Definitely stay away from imaging unless you have long-term 2, 3, 4 weeks worth of complete weakness in one limb, or if you're getting excruciating symptoms down both sides, or if you're having issues with balance. That's when you definitely want to go ahead and make your neurosurgeon your first primary source of seeing a medical professional. So I really like to have a patient come in and we talk a lot about what are their symptoms. And I just want to go through different types of acute back pain. You have musculoskeletal back pain, patients who say that their pain is very central, might be on one side or the other. That's very easily taken care of with strengthening exercises. It's not necessarily anything to worry about. And then patients also can come in with radiating pain down the back or the front of their leg. And this radiating pain can be made worse with either bending forward or bending backward. And as doctors of physical therapy, we really like to differentiate between these two types of patients. Disc herniation patients are going to tend to have worse radiating symptoms down the leg when they bend forward as they put pressure on those discs. And they're going to notice that as they bend backwards, those radiating symptoms down the leg tend to disappear. They may feel more intense pain in the actual back, but that's okay. And the other type of radiating back pain that can exist is called a spondylolisthesis. I have no idea who in the heck makes up these names, but it's called a spondylolisthesis, or spondy for short. And that just refers to a vertebra that tends to slide. So kind of imagine a stack of plates, and one of those plates, as they get squeezed in the back, tends to slip forward just a little bit. And so for these patients, they tend to find that as they bend backward, as they arch that back backward, there's not enough support on the front of their back, and that vertebra will slide forward. So their symptoms, those leg symptoms, will get worse as they bend backward. And as they bend forward, utilizing their abdominal muscles, crunching forward, rolling forward, they'll notice that those radiating symptoms do disappear. And these two types of what we call radicular or radiating back pain patients are very, very easily treated. Disc herniation patients, again, those patients where bending forward makes those symptoms worse. We see that a little more commonly. Back manipulations actually have been shown to really, really help these patients. Again, if they're seen within 14 days, that makes a big difference. Arching backward exercises, oftentimes a little bit of self-traction, even hanging off of a chin-up bar can make a big difference if you have these symptoms. Abdominal strengthening, always, always, always with any type of back pain is extremely important. Those deep abdominal muscles, we'll talk about that in just a few minutes, and things that you can do at home. So disc herniation, we're going to do some manipulation type treatments. You're going to have some homework to do, those back extensions throughout the day, just arching that back backwards. And again, I'm kind of assuming that you maybe haven't seen a physical therapist, but definitely try to see a physical therapist. And if you haven't, just add in some of those back extensions if you are experiencing some acute discomfort of what we described. And if you have a spondylolisthesis or a spondy, remember that's that radiating pain that's made worse with arching backward. Going ahead and coming into a position where you can lay on your back, bring your knees to your chest, and really overemphasize that forward rolled position of the low back. Doing lots of abdominal strengthening positions, really avoiding arching the back when you do things like changing a light bulb, lifting things out of your closet. That's really, really important. Okay, so now I want to just talk a little bit about after you've seen the physical therapist, if you have a disc herniation. It's really been shown even with MRIs that your disc herniation will actually resorb 6 months down the road. So if you compare two MRIs, that MRI is going to look substantially better 6 months down the road after seeing a physical therapist. So you can make changes. Surgery is not the answer with disc herniations, with spondylolisthesis, with back pain, even with chronic back pain. It's very much more important to do strengthening exercises, to get some manual therapy, and to stay active. And a lot of this research now that's happening with joint manipulations, back pain, even cervical pain, thoracic pain is actually physical therapy-driven research, which has been really wonderful for the profession and for all of our patients. All right, so now enough with some of the boring stuff. Let's go ahead and talk about a couple of things that you can do at home to help you feel better. I really like my patients. These are non-spondylolisthesis patients. Again, as long as you have just basic back pain, you're not getting that slippage of the vertebra. I like patients to get something called a mini fit ball. You guys know what I'm talking about. Those big exercise balls that you can sit on. You do exercises on. It's a mini version of these. You can get them on Amazon for about $10. You blow that up about halfway, and you can use that underneath your lumbar spine so that you can safely do abdominal strengthening. And I'll have patients do static hold, so they're holding their upper body off of the ground, kind of in that crunched position, but not actually doing crunches. They can do slight movements, practicing so much using those deep abdominal muscles called the transversus abdominis. And those muscles are the muscles that don't run up and down or diagonally. They run right along your belt line. So when they engage, they actually increase your intra-abdominal pressure. They support your sacroiliac joints, your pelvis, your low back, and they give you that stability that we're in such dire need as a society because we sit so much. We don't do much standing. So what I would encourage you to think about is drawing your belly button in. Imagine someone actually sticking their finger in your belly button and pushing that belly button towards your low back. And then they remove their finger and you want to hold that position. I also kind of refer to this as imagining sewing a button on a pillow. Again, drawing that belly button in. You're not pulling your stomach in or sucking it in. You're just gently pulling that belly button inward, engaging that transversus abdominis. And our goal with patients and people in general is for them to get to use that muscle on a regular basis throughout the day, whether they're sitting and doing work, driving to their basketball game, or doing the laundry, cooking, cleaning, things like that. So drawing that belly button and learning to hold that's a really good one. So we talked about the exercise ball, the belly button drawing in. And the last one I really like patients to do, and these are all very simple exercises, is just a basic plank. So whether you want to do your plank up on your hands, on your elbows, or if you don't even feel comfortable on your toes coming down onto the knees, you really want to think about someone coming up underneath you, punching you in the stomach, bracing against that, and holding as long as you can. Planks are a wonderful, wonderful way to practice deep core stability. So I like patients to get into doing their exercises. And again, these are 3 really simple exercises that'll take you anywhere between 5, 6, 7, 8 minutes. Do them and attach them to things that you do on a daily basis to make it habit. And that's most of our problem. I am super lazy with exercises. I'm a terrible patient. And so I have to attach my exercises to something that I do every day. So every evening before I brush my teeth and floss my teeth and get ready for bed, I pull out my exercise ball. I practice my planks and I practice pulling my belly button in. And if you can spend 5 to 8 minutes on that every evening, you can actually help prevent low back pain in the long run. And again, the next time that you have an acute back pain issue creep up on you, go ahead and see your physical therapist first. Practice some of those exercises, and most importantly, don't get worried about back pain because your back is healthy, you're healthy, and you should stay moving. I hope you found this helpful, and if you would like more information, please visit my website at redhammerrehab.com, provided on the show notes. You can also email info@wispsports.com with any questions you may have about sports injuries. On the next episode, I will be addressing another popular topic, and hopefully you will learn something about that. There will also be links in the show notes accompanying this episode at wispsports.com. Just go to listen and click on Ready, Steady, Rehab. For more conversations from the world of women's sport, visit wispsports.com and subscribe to Wisp Sports Radio on your podcast player. You can also post your comments and share on social media. Just look for @RedHammerRehab and @WispSports. Thanks so much for listening and, of course, supporting women in sport everywhere.
Well, you can't see